Good morning, everyone. Welcome. Welcome to the first event, Plenary Zero of PMAC 2024. I regret to announce that the high point of your morning may be behind you at this point. So you have seen a real princess. You've heard from important people like Professor Vicharn, who's the chair of many things. And now you're stuck with just us. But that's okay. We are here to open the conference in the substantive themes that it raises: geopolitics, governance problems, and colonialism. This marks an important day, an important event in the history of global health conferences. This is the first one to raise these themes. And I regret to inform you that you will probably learn nothing, but you will realize a lot. In this panel, I am joined here on stage by four distinguished panelists. We will also hear first from Minister Takemi from Japan by video. So I'll ask the organizers to begin with that. Following that, we will have some discussion up here and questions and answers with all of you. So thank you for joining us. And please let's turn to Minister Takemi. Thank you.
Good morning, everyone participating in the Prince Mahido Award Conference. I'm Keizo Takemi, Minister of Health, Labor and Welfare, Japan. I would like to pay my sincere respect to Your Royal Highness Princess Mahachakri Shiriton, the Kingdom of Thailand, the host of this conference, as well as to various stakeholders, and also express my deep appreciation for your ongoing contributions to the global health. I have participated in the PMAC many times since before appointed as minister. The huge earthquake hit the Noto Peninsula in Japan on January 1st this year, and this requires me to be immediately engaged in a crucial life-saving and restoration efforts in the affected area. That I am unfortunately unable to be there at this time, but very pleased to make a remark as minister in this wonderful gathering of global health professionals from all over the world. I would like to take this opportunity to express my deep gratitude for warm message and support from many countries and organizations concerned from those suffered from the earthquake. Now, the main topic of this year's PMAC is the quote, geopolitics, human security, and health equity in the era of the Polycrises, unquote. In 2002, the Professor Sadako Ogata and the Professor Amartya Sen focused on the security of each individual human being and developed a policy concept of human security from a micro perspective, the combining human empowerment and human protection by considering a community as a basic unit. In the 2 decades since then, the climate change has become much more serious, and the risks of the pandemics has steadily increased. While digitalization has accelerated the progress of human society, there are also aspects that create the new threats. As a result, the need has been recognized to consider the security for human society from a macro perspective in addition to human security from micro approach. And 2022, the special report, New Threat to Human Security in the Anthropocene, was published by the UNDP. In this respect, coexistence of human society and the Earth, this planet, in the era of the Anthropocene is being sought in various fields, and the necessity of the solidarity beyond national boundaries was emphasized for its practice. While we are now in a time when the interrelationship between the security of each individual human being and the security of the human society as a whole is becoming the more proximate. Unfortunately, the geopolitical conflicts are becoming much more serious and the fragile of the existing international political order, such as the UN system with sovereign countries as the unit, is becoming more pronounced. These two contradictory political momentum inherent in the human society are giving great impact also on the global health. It is becoming more difficult for us to reach consensus among sovereign countries and creating new international organizations and concluding new international treaties are becoming less easy. Therefore, under such a difficult international political situation, a more realistic approach is to set an agreeable goal and to work together on necessary existing international organizations, sovereign governments, civil society stakeholders, and also industries with the common purposes to achieve that goal. I call this the soft governance approach. The ACT Accelerator and the COVAX facility during the COVID-19 pandemic were the first step in this soft governance approach, while they may not always work well. Now, based on this soft governance approach, what is a realistic goal for the sovereign global solving global health challenges in the search of the equity? I think it will be to increase the scale of health financing in low and middle income countries and to achieve and strengthen sustainable universal health coverage financing. Specifically, it is to create a global hub function, including for financing, knowledge management, and human resources on the universal health coverage. Japan is currently working with the WHO and the World Bank to realize this hub. We believe that this will embody solidarity in the global health. We are now moving into a post-pandemic era, having overcome the threat of the COVID-19, but as Japan is now suffered from the severe earthquake damage, the next health emergency could strike at any time and anywhere. Whatever complex the policy crisis we face, let us move forward the next era of global health based on the solidarity among all stakeholders to establish an environment in which all the people can receive the equitable health. I'd like to conclude my remark by expressing my expectation that the discussions at this year's PMAC will be fruitful and it will be able to make a significant contribution to solidarity in global health. I look forward to seeing you in person the next time. Thank you.
We thank Minister Takami for his remarks, and I thank all of you for joining us. I think there could have been a misunderstanding earlier because of my serious demeanor. You might have thought I was joking, but I did mean that you would probably learn nothing, and the high point of the day could be behind you. You've seen the princess and heard from important people. So at this point, I'm not sure we have very much to add, but we hope to entertain and entice you to think in new ways. Here on the stage with me, we have Irene Torres from the Octadero Foundation in Ecuador. We have Assistant Secretary for Global Health, Atul Gawande from USAID. We have Naomi Tulai Solanke from Liberia and the community health organization she founded. And we have Professor Kishore Mahubani, from whom you heard earlier. This will begin our opportunity to hear from the panelists. You will see there are some microphones set up over there, and you should feel free to line up when you have questions. We will hear a little bit from the panelists as we go along, but first I wanted to point out that Professor Kishore has written 9 books, and a 10th one is soon coming out. He was appointed to the UN Security Council, the ambassador to the UN, on 2 occasions, and I wondered maybe if that's because the first occasion didn't go very well and he needed a second chance. Well, the titles of his books often ask questions, and I wondered if this yes and no pattern might hold for them. So one of them is, can Asians think? And I wondered, did he mean no? Another one was, has the West lost? And I wondered if he meant yes. So Naomi from Liberia and Irene from Ecuador are spared those indignities, but Atul and I from the West, we have lost. And as of Asian heritage, he's also unable to think. So this is another reason why you may learn very little from us. We are going to talk about things that you already know. That's what I promised you, but I want to illustrate the things that you already know. For example, you already know that powerful nations pursue their own interests, right? Or you didn't know that? They do, okay? They do. In case there's any uncertainty out there, powerful nations pursue their own interests. And you could see in the COVID-19 pandemic, there were deadly consequences to that. There was no sharing of vaccines. There was no sharing of vaccine manufacturing know-how. So that's point number one. And that's why in this conference we are talking about geopolitics. The second part, which you already know, is that the governance structures at the global level give more power to some nations than others. And many people find that unfair. Did you know that too? So I see some heads nodding. Some people are aware of this. Some people, and particularly Professor Kishore, who is the president of the UN Security Council, will know that all of the UN organizations have a special mechanism that gives some countries more power than others. We are here to talk about that. You already know that, but these things aren't widely spoken of. And here at the Prince Mahidan Award Conference, it was the thinking of the organizing committee that these things needed to be talked about because of their profound impact on health. We know these are not commonly mentioned, but we also know that everyone knows them. And it's our hope that we can stimulate thinking about that and find a way forward. The third of our themes, which also breaks new ground for an international conference, is colonization. Many of you already are aware that colonization is one of the most profound episodes of history and has had an extraordinary impact on our world today. So in keeping with my promise not to educate you, I bet most of you knew that colonization has effects for today. Is that right? Is there anyone here from India? Maybe a couple? And do you know where the Peacock Throne is? No one knows where the Peacock Throne is. Okay, head to Google and find out. My point is simply that resources that were extracted in the colonial period remain extracted. Those are resources. Sometimes they're cultural resources, and sometimes they're just ordinary operating revenues from minerals or from products that countries will need for their health systems. These are the three themes that we're going to talk about today. So I hope from my opening remarks you have learned nothing, but have drawn your attention to these three areas. And now we'll turn to our panel. I'd like to start on the other end. In one of his many books, Professor Kishore has raised the proposition that the geopolitical scramble between China and the United States is reshaping the world. And one of the recent episodes in geopolitics has been the war between Russia and Ukraine. Professor Kishore observed in the Financial Times that there's a growing feeling in the global south that the rush of aid for Ukraine is leaving other nations feeling like they're less important. So I wanted to ask you to comment on that, Professor Kishore, and see if there could be a way forward for us.
Well, thank you. I can see this is going to be a very active, provocative panel discussion, which I actually enjoy. Well, I mean, let me first of all say that the Russian invasion of Ukraine was illegal. And as a former ambassador to the UN, I can say categorically that it violated international law. But at the same time, in the response to the Ukraine war, the thing that's striking is that even though a majority of countries in the United Nations voted to condemn the Russian invasion of Ukraine, when the West imposed sanctions on Ukraine, I think the West was surprised to discover that 85% of the world's population didn't impose sanctions on Russia, sorry. When the West imposed sanctions on Russia, the 85% of the world's population didn't join them, including, by the way, fellow democratic countries like India and Indonesia and all that. So I think that was a signal that was best described by the current Indian Foreign Minister, Dr. Jaishankar, when he said, Europe always thinks that Europe's problems are the world's problems, but the world's problems are not Europe's problems. So I think when I mentioned the question of health equity in my remarks in the video, it's very important to see whether or not you distribute resources fairly across the world. And certainly we have to support Ukraine, no doubt whatsoever. But at the same time, there are other countries in many other parts of the world that are also in distress, and in some cases in acute distress, but their problems are ignored. I think we must therefore try to create a more equitable formula for handling all the issues of the world and not just focus on one or two.
Okay, thank you. Thank you for those remarks. Also a best-selling author himself, I wonder if we could turn to Professor Gawande for some remarks from his perspective on that. Thank you.
Thank you. I don't even know where to start. Geopolitics clearly matters, and I think that there's a profound misunderstanding, however, if we think that the world is a bipolar world these days. Let me start with the claim Professor Kishore made in the video that the U.S. That the cause of the COVID pandemic was that the U.S. failed to cooperate with China. The critical element that caused this to be a global catastrophe was 2 months of circulating virus with known human transmission and action not taken and the information not made transparent. We saw in Ebola in 2014 and 2015 that when you have circulating virus for months, as we did with Ebola, that action then takes a huge amount of time and effort and resources to address because it rages out of control at that point. We actually, in the last 2 years, have had 6 Ebola and Marburg, cousin of Ebola, outbreaks in Africa, which cooperation, global cooperation, has enabled a rapid response that stopped every one of these cases before they became global catastrophes, a signal of the ways in which investment by many countries around the world, US being the largest donor, had enabled a global health security response that told a very different story. That brings me to the second point. A more fundamental aspect is that geopolitics right now is not best understood as a bipolar world. It's not even a G7 world. It's a world where there are many, many elephants, including technology enabling non-state actors to be enormously powerful players in the world. We have the Russian invasion of Ukraine that was alluded to, leading to a food crisis in Africa. And then now with Houthis attacking ships that are attempting to move food assistance to Africa, those same shipping lanes have stopped again, and we're bringing on a food crisis from a non-state actor. So the alignment around the world is one where we're coping with what one colleague of mine called a G0 world, one where there are many, many powerful actors. The US is hardly the only one, and we're in a world where the fundamental divide is one where we're either committed to multilateralism, to cooperation, to the belief that coming together can actually drive solutions in the face of complex geopolitics. The fact that the last 70 years we have come together in public health in ways that cooperation has dominated despite a Cold War, in spite of hot wars, in spite of nuclear weapons. Year after year for 70 years, you saw a process that ended up ultimately doubling the human lifespan from where it was a century ago. And that progress was halted during the pandemic, the first global reduction in life expectancy in 70 years, but we're back on the upswing, getting back on track to that pattern. I would agree with the discussion that our biggest threat is one where open societies are replaced by closed societies, a belief that we are each on our own. The notion that, but this is a debate going on in every country in the world. It is fundamentally a threat that if we have another President Trump, that we have a move again to a world to a U.S. that is different from what we have embraced today. Under President Biden, we embraced multilateralism. When President Biden came into power, we returned to the World Health Organization. We embraced and invested in COVAX. We became the biggest donor of COVID vaccines to the entire world. We did not, like others, like China did, sell vaccines on the market for a profit. We put out donated free vaccines to the world in the name of the challenge we were up against. The reality of our commitment in the U.S. is that where we see today our opportunities, it is around recognizing that we have to fight for open versus closed societies, multilateralism and cooperation as opposed to unilateralism. And that fight is going on in many of our countries, politically and in power terms. So the world is not done with having this fight. It's critical for all of us to come in behind the notion that cooperation will matter.
Thank you. We're going to continue with our panel, but I wondered if we could conduct a quick poll in the meantime. You guys ready for a poll? Okay, good. Some people are ready for a poll. I want to ask about COVAX. It's true that the United States and other countries have given generously to COVAX, but I would like your impression about whether COVAX worked effectively or not. So if you think COVAX worked as designed and equitably distributed vaccines around the world, please stand up. Oh, sorry. Okay, so the poll is over. Our poll is over. And COVAX, just to be clear about this, COVAX is not a USAID initiative. And the decisions that the Assistant Administrator for Global Health, the decisions that they make, they don't impact the COVAX. But I want to ask, like, how do we go forward in a better way? Like, I know people who designed COVAX. I'm sure all of you do too. You know people who thought about it. The ideas, generally speaking, most people think the ideas were good. But then when it came to execution, when it came to sharing, the world didn't do so. What do we do about that? I mean, just for a couple of seconds, and then we'll come to Irene, but just for a couple of seconds, can you help us think about how could we manage these geopolitical rivalries or the commercial rivalries that sustain intellectual property rights restrictions? How can we go beyond that to get health for everybody?
Two core things happened. There have been several analyses that have pulled apart what was the gap that occurred. It was not in the construct of COVAX. The two critical factors was, number one, where we had a substantial amount of money, like the World Bank had funds available for low and low middle income countries to access vaccines. Most of that funding was unable to be put at risk. So that it was where differences happened was that the wealthy countries in the world, US included, started buying vaccines before they were even proven, put money down at risk, knowing that it might be lost if those vaccines didn't work. World Bank and others wanted WHO approved vaccines before being able to put money down. And so being able to have cash at risk for the low-income parts of the world when there's the next crisis was a critical point. Second was that there was a large supply of vaccine, but for example, when India got hit by Delta and then, of course, took care of their people first, that critical source of supply also got cut off at that time. And we are now in a world where we recognize two things that need to be addressed. One is surge financing, and Gavi actually announced just recently access to lines of credit that enable now starting at $2 billion for purchase of vaccines that could be put at risk ahead of even approval of vaccines, and that is a critical part, that the low-income world needs ways to access vaccines even before they're created to be able to have that opportunity. Second is the building of regional capacity and the rise of regionalism as an important factor, the ability to have regional centers of capacity for medical goods is a vital direction that we're moving towards. But the notion that we wouldn't have, that a COVAX-like capacity is not what the world needed, I think is not correct. The COVAX did end up being a vital supplier throughout the world, but the challenges were those two ones.
Okay, good. I hope we are upholding our promise to make sure you don't learn anything. Are we doing okay on that? So some of the things to clarify that you already knew and thus did not learn here are that geopolitical forces are extremely influential on health. And also, although we can imagine a solution where people cooperate, we don't know how to get there. Okay? So you have a whole conference to figure that out. Now, Irene, let me turn to you and let's pick up this geopolitical thread again in your region of the world. How do things look from Latin America?
Hello, yes. Where I come from, in our region of the world, as you put it, we don't have elephants. So when the elephants are fighting, as Professor Kishore said, the grass gets damaged. Is that what you said? Yes. So I'm imagining it's when the US and China are fighting, the rest of us get damaged. Well, in 2015, what is called the Venezuelan exodus began. And until today, around 7 million Venezuelans have left their home country and relocated in different countries, especially South America. In Ecuador, which is a tiny country of 17 million people, we have 450,000 Venezuelans currently. If you're not aware, part of the crisis in Venezuela is due to the US embargo. So it wasn't due to the fight between elephants. It was just one elephant who was trampling on the sovereignty of Venezuela. We may not agree with the politics in Venezuela, but definitely the embargo catalyzed and made it more deep, made the crisis more deep in Venezuela. What's the problem with the elephant metaphor, I think, is that it's a damaged, centered approach. We're focusing on the grass that gets trampled on because of the elephants. In the case of Ecuador, we welcomed the 450,000 Venezuelans. I conduct scientific research on migration and health, and as a fact, the number of medical consultations for Ecuadorians decreased as the number of medical consultations increased for Venezuelans. So if you want to talk about solidarity and the search for equity, I think certainly, and I'm not doing propaganda for the government because we argue a lot with the government and we criticize it a lot, but it is a clear example of solidarity and the search for equity. With 450,000 Venezuelans who are living currently, many of whom don't have a residence permit because they have not been able to retrieve their documents or their passports or their diplomas from Venezuela. And so instead of us thinking from a damage center approach, the grass that gets trampled on, we have the creative, sensible ways to deal with the needs of, I'm talking high number of people across South America who can have access to social protection, to education, where children can also have access to healthcare services and directly medical consultations through the general health system. So as the elephants are fighting elsewhere, because as I said, we don't have any, we look with creativity, with sensibility, on different approaches, not a damage-centered approach. These different ways of subverting the mechanisms of power that may affect us, but in which we try not to get engaged.
Great, thank you very much. I think we've spent some time on our first theme of geopolitics, and I'm hoping we've established some grounds for discussion in the days to come and the sessions that follow ours. So I'll pivot just a little bit to start talking about governance, and I'll ask Naomi to begin with some comments about that. And what I was thinking is that we've talked about geopolitical rivalries and their influence on where aid goes and what it's for and whether people are willing to cooperate or not. And from your perspective, as the leader of a community organization for women and girls in Liberia, you end up on the receiving end of calls for proposal of funding and working with donors. How does governance look from that perspective?
It's very complex, and we, as he rightly said, in terms of what equitable and mutual partnership looks like, most of the funding that come into developing countries like Liberia are from former colonial masters, and they control the narrative around what those funding or what the support should look like, and most often, the local solution is lacking. And we see that over and over, the aid world is not sustained because it's always like what comes from the developing country, what the elephant said, since that's the narrative, if what they have desired and designed in the head that works for the local community. And most often what the power set in the influence, the local community are aware that these solutions are not the right solution for them. But again, they don't have the negotiating power to say, this is what we want to work for us. So at the end of the day, they accept whatever is given to them, and we see repeatedly that it's not sustainable. And we'll go back to COVID or Ebola. We all know in 2014, Liberia was one of the countries in West Africa hit with Ebola. We have thousands of resources poured into the country. That didn't stop the spread of Ebola. What stopped the spread of Ebola was the local initiative. When the local people was given the space to lead on this response, on the local technique, that helped to prevent the stop and the spread of Ebola. A lot of time we don't talk about that. We don't talk about local solution. We go back to COVID. We all saw the death rate in all of the Western, the big countries. In Liberia, we sat down and listened to the news, and we felt that we were all headed for the place of death. Looking at countries like China, America, Europe, seeing the death rate, and we saw the logistics that were needed to fight COVID. Looking at our health system that isn't even prepared to fight malaria. How are we going to fight COVID? However, we remain on the continent, reported the lowest fatality rate for COVID. Are we investigating? Even we remain the most unvaccinated in the world. The vaccine distribution is not equal. It's not distributed on the equal level, and what is given to us is what we're going to accept. So when we look at the ill world, it is about time that we try to shift power to local solution. The solution is within the communities. We need to practice the bottom to top approach. We need to ensure that the solutions to have partnership with local communities so that we are all on the same level is to recognize that they have agency, they have leadership, and they too can lead. All they need is the support, and we should be intentional to pass the mark with that support.
Okay, so we have heard a valuable perspective from Liberia, and I think there's probably a way to expand that to a global perspective. So, Naomi, you spend your normal work days when you're not here joining us on vacation delivering services, right? And if someone from a donor agency were to come and visit you, would they be helpful to that mission, or would they be adding burdens or complications?
It depends. If you are coming in to work with me with the solution that I have for my community, take from the perspective that I understand the context, the religious, the traditional context of my community, and you want to partner with me from that perspective, it's burden, but not what we receive more often. What we receive is, we want to, for an example, there is a call for proposal of aid, and they tell you exactly what they want to solve. They are not asking you what is your problem. They have assumed that the problem is this, and this is what they want to solve. And it's becoming very problematic. So in terms of the lack of resources and access to resources, we don't have the power to negotiate what we want. So it's the same white savior complex. As soon as whatever comes from in the developed world, we are happy to accept it, even if it is not good for us. Now we are shifting the power. We are now challenging that. And how many local organizations or CSO or grassroots women-led organizations that don't have access to resources can say no to funding? It's challenging. So it's now for the world power to look at where they sit, they influence the whole, and how damaging it is when you are not involving local technology and it's not sustainable.
Okay, so if I have understood this, Naomi here delivers services with good ideas and good results. Maybe we should have a round of applause for Naomi. Yeah? Yeah. Yeah. I think that's what we're all about. That's what we want. Everyone in the room wants that. And Naomi's biggest problem isn't the lack of ideas, it's the lack of resources. I understand that Liberia has some of the largest rubber producing capacity in the world. So where's that money going?
I don't know.
Okay. That answer was, I don't know. And I think probably many of you come from countries that have significant natural resources. Anyone here from the Democratic Republic of the Congo? Source of over half of the world's cobalt. If you have a phone in your pocket, then you have minerals from DRC. This question about where resources are and where they should go is extremely important. So you can add it to the list of things that our panel has been unable to solve for you. Where is the money? How did it get there? And how could it be distributed in the ways that maximize health? Is that a fair question? And if you follow up on additional fair questions, one of them would be, how do the activities of our global agencies and donor agencies, how do they translate into health or well-being on the ground? So Irena, I wonder if we could return to you for a perspective about that.
That's a tough question. We are also dependent on natural resource exports. Plus, we are the cheese in the sandwich of international drug trafficking. We currently are in a formally recognized internal armed conflict for the past 2 weeks. So if you ask me, where does the money go? It's internationally laundered and protected, also in the US. But I guess also Georgia and other countries in the world. How can we change how the money is arriving to fund health services or health care and social protection to the people? During COVID, for example, the US government provided a couple of $1 million to a large US organization. And we actually did the evaluation of this intervention. And I can tell you that although NGOs, like my own NGO, are part of the health system setup in which we either influence policymaking or provide scientific evidence for policymaking, we are not able to make decisions of how that money is spent, really. So in the case of the COVID donations, it translated into salaries, expenditures of a large international organization. And it was not translated into concrete health services, social protection, except in minimal quantities. So international organizations are part of the health system setup, unofficially, but they are. But they're probably the most resource demanding of this setup because they have their overhead, their salaries, their own traveling, and in the end, it's not spent where it should. So, Jesse, I think that either they don't give us any money, that's an option, or if they give it to the country should know how to spend it. And of course, there is corruption. I'm not going to deny it. So there is always the fear. What are they going to do with the money? But there are examples of successful investment in health in Ecuador and in the region where we can see that the money can be well spent, can be well invested.
Okay, thank you for that. So if we connect that to Naomi's point, it would seem like the best objective for donors is to find the Naomis of the world and give them money and leave them alone. Does that sound okay to you?
Definitely.
Yeah, okay. So we have raised questions here in 3 areas. We have geopolitics, we have governance, we have colonization. As the conference unfolds over the next couple of days, I want you to think about each of these areas. I promised that you wouldn't learn anything, and I hope that we have been able to meet that standard. We've only had, I guess, one person stand up at the microphone with a question, so that's a good sign. Or maybe it's not even a question. Oh, good. I thought we had taught somebody something. Anyway, what we have now is our discussion opened on topics that people have already known about, but have often not discussed. And the time to discuss them is now. This is the time to start talking about geopolitics. Health people tend to think in narrow terms, in clinical terms, in local terms, in technical terms. We now need to think about big terms. We need to think about geopolitics and how to manage them. We need to think about governance structures and how to make them fair. And we need to think about resources and how to put them in the right places. Those are three really, really important questions that thus far have gone unanswered to the detriment of global health. Now, I've disappointed myself and attracted a few questions. I'm not sure we're going to have time to answer them, but maybe we could at least just ask them to get them out there. Maimai, do you want to begin?
Hello? Okay. So I would like to unpack the reference to Houthis' attacks on ships affecting a food crisis, especially as some of the ships bring support to the ongoing crisis in Gaza. How do we navigate this complex web of geopolitics? Thanks.
An excellent question. And then please, on this microphone, let's just try to ask our brief questions, and then we'll yield the stage to the next panel.
To quote George Orwell, all animals are created equal, but some animals are more equal than others. Likewise, within the UN body, as you have mentioned, certain countries have more powers than others through veto and other apparatus, which are, upholding this sense of inequality. So how crucial do you think, therefore, are the dismantling of these institutions that proliferate inequality in achieving health equity and decolonization? And how do you think this task should be undertaken, and if so, how?
That's a splendid question. Yes, let's have another one.
Good morning. My name is Ebero Kereke. I'm from the Africa Public Health Foundation. And I have more of a comment than a question. And as we've been using analogies of proverbs, I want to use a slightly different one. And this is a quote from the Synoptera, which is a very old poem, where it says that big fleas have little fleas upon their backs to bite them, and little fleas have lesser fleas, and so ad infinitum. I prefer bugs because my background is infectious diseases. But the reason I quoted that was I don't think that the conversation so far, where we're just pitching the argument of geopolitics and its impact on health, is just an America-China thing. That conflict is replicated at multiple levels of our economies and our politics and our nation states and even within nation states. Global health is the most democratizing opportunity for discussing geopolitics because everybody has an investment in health. People are much more disconnected from cobalt in their mobile phones, but when it comes to health, they actually understand the impact of politics. So I think that in this conversation, we need to, yes, the big powers have a significant disproportionate impact, but we also need to look at this discussion and this narrative at the next tiers and the tiers below and the tiers below. It wasn't just the China-US dichotomy that created some of the challenges we experienced in the pandemic. Let's not forget the fact that once South Africa told us we had the Omicron variant, everybody else piled in on them. So geopolitics happens at multiple tiers, global, national, regional, and in trying to address how we respond to this, we've got to look at them at those tiers as well. Thank you.
Excellent. Thank you. Please.
All right. Good morning. I'm Augustus from the Philippines. I would like to continue the Indian proverb, which states that when the elephant fights, it's the grass that suffers. But what about the grass that whispers so that this chaos is in existence? For instance, in our region here in ASEAN, we are very silent with the Myanmar issue because there's no enough whispers from the grass. So what about the grass? Thank you.
Thank you. Gitinji, please.
Well, thank you very much, Jesse. And I wanted to stand up when you said whether anyone thought that covers worked, but my seat did not move back fast enough. Let me come to the defense of COVAX. I think the danger that we have is actually to shoot the messenger. And if you look at the troubles of WHO, where WHO has been accused of failure, it is because the powers behind WHO wanted a different song, and they were therefore playing different tunes. Even now, when we have WHO that suffers, because they don't have adequate money for their core activities, we say WHO is a failure. But we know all the money they receive is actually restricted by the donors, the same conversation we're hearing from Liberia here. So when we look at COVAX, many of us from Africa know that without COVAX, we would not have accessed even the little vaccines that we accessed. Because vaccines to Africa come through Gavi. 75% of Gavi's business is actually Africa's business. So COVAX, if we keep attacking COVAX, we are basically we are attacking the thought processes, ideation that tries to handle global health governance. What we should actually focus our challenge on is the countries that hoarded the vaccines, those are the powerful countries, the countries that denied the pipeline of supply to COVAX for it to deliver to the poor countries. So we are actually misdirecting our efforts to COVAX. Well, actually we could call out all the countries in Europe, the US, which is seated here, and others that hoarded the vaccines that COVAX had promised to deliver to the poor countries. So let's redirect our efforts to where the blame belongs. Thank you.
Thank you, Gitinji. Yes, okay, we'll take our last two questions and wrap up, okay? Please, you in the back.
Thank you. Sam Sellers with USAID. One of the things that a tool speaks about often and our administrator, Samantha Power, speaks about is the idea that at USAID we believe that all lives have equal value. And that's a values statement that we strongly believe as an agency, but that's not necessarily congruent with how geopolitics works. With respect to the professor, we don't live in a country, or in a world rather, where we all have equal power. We live in a world with 195 nation states, and each of those nation states don't value lives equally. They value the lives of their citizens ahead of the lives of other people. And that informs what we've seen in recent global health responses. And so I'm wondering if the values that so many of us in this room hold blind us to the realities of geopolitics and make it hard for the public health and the medicine communities to influence those systems in ways that sort of meet geopolitics where we're at right now. Thank you.
Thank you. And final intervention here.
Okay, I stand up against big hypocrisies. Because that's true that the developing world was neglected. Yes. Even in my country, my country pay in advance without tax money some vaccine, and those vaccine has been diverted to Germany. All the people involved know that. Nobody stand. This is piracy. Nobody stand up because it was Germany. So this, we talk about is a true problem, but we don't talk about the real geopolitics piracy that exists in the world. I would like us to reflect on that. Because, okay, we seem to be good people who are going to work for our people, our poor people, etc., but it's not true. Europe misbehaved. America misbehaved. You are not talking about that. And for me, it is the true problem.
Yeah. Yeah, I told you, we're going to talk about things you already know. And now, PMAC 2024 is open, and we are going to talk about them. That's what's new. It's not that these things are unknown. What's new is we now have a conversation where we can say some nations have misbehaved, and we want accountability. Some nations have made pledges that they don't uphold. Some nations don't value all lives the same. We need to talk about that. I'm delighted.
Yes.
Am I going to learn something?
Yes.
Okay.
Because we are talking, we are members of civil society or government, etc., but we will have no power except if we manage to enact global laws that countries are obliged to implement. Because there are some countries that should have been gone in trial in international court for their behavior during COVID crisis.
Okay, that's a great governance question. Please, everyone, join me in thanking our panel. Thank you for coming. and I look forward to the many discussions.